Hello guys, so now let us discuss about the ducts of the pancreas. Okay, so what are the ductal system? So what are the different ducts of the pancreas which we have got? So here, if you see, this is your duodenum. All of you know that this is your duodenum over here. This is your C-shaped loop duodenum. Okay, and next important thing is that here you have got some very important ducts. Okay, so what are those important ducts over here? First of all, you have to draw the pancreas. So this is the pancreas over here. So this is the uncinate process of the pancreas, and these are the pancreas over here. Now here, if you look very clearly, that here you have got two different types of papilla. Okay, what are the two different types of papilla? Here you have got two important types of papilla. So this papilla which is located on the top, okay, this papilla which is located on the top like this is called as minor duodenal papilla, and this papilla which is located on the bottom here is called as major duodenal papilla. So you have got minor duodenal papilla and major duodenal papilla. Next important thing is that in the center here you have got a duct. Okay, let us say this is the duct that is located exactly in the center. Now this is called as a main pancreatic duct. What is this duct? This duct is called as a main pancreatic duct, and this main pancreatic duct has got some branches. Okay, so these are the branches which are located for the main pancreatic duct. So actually these are the small ducts. All these small ducts together they join and drain into this main pancreatic duct like this. Okay, so how is this ductal system which is arranged here? This ductal system is called as herringbone pattern. What is this pattern? This is called as herringbone pattern, right? The way it is arranged like a fir tree, right? So it is called as a herringbone pattern. And the duct which is located in the center is called as a main pancreatic duct. Now remember one thing, that this main pancreatic duct will come all the way down here. Okay, and from the liver, I will tell you in a minute later on when I will discuss about that. From the liver you have got common bile duct that is coming. So let us say, you see, this is the common bile duct which is coming all the way like this. Okay, now look what is happening. This common bile duct as well as this main pancreatic duct, they both of them join together like this. The common bile duct and the main pancreatic duct, both of them are joining like this, and they join together to form a new duct like this. They join together to form a new duct. This is called as hepatopancreatic duct. Why? Because there is contribution from the liver, there is contribution from the pancreas. So hepatopancreas duct, that is called as hepatopancreatic duct. Okay, so this duct over here is called as hepatopancreatic duct. So let me just write down the things so that it would be easy for you. So this structure over here in the center, right, this is called as the main pancreatic duct. What is this? This is called as the main pancreatic duct. Now in this main pancreatic duct, all these small ducts which you can see over here, they are arranged in the form of a herringbone pattern. Herringbone pattern. They are arranged in a herringbone pattern. Okay. Now here the duct which you have over here, I told, what did I tell you? Main pancreatic duct, and this duct which is coming here is called as common bile duct. Common bile duct and main pancreatic duct together they join and form hepatopancreatic duct. Okay, so this duct over here is called as hepatopancreatic duct. Hepatopancreatic duct. Okay. Now, what is this papilla by the name? This papilla, I told you, this papilla should be called as major duodenal papilla or minor duodenal papilla. This should be called as minor duodenal papilla. Okay, minor duodenal papilla. Whereas this papilla over here is called as major duodenal papilla. Major duodenal papilla. So there are two papillas, one is called as minor duodenal papilla and the other one is called as a major duodenal papilla. Now look here very carefully. Here I am going to draw one more duct, okay. Now this duct opens into what? This duct is opening into minor duodenal papilla, and this duct comes all the way down like this. This is a duct like this. Okay, this duct is separately opening into the minor duodenal papilla. So this duct name is called as accessory pancreatic duct. So what is the name of this duct over here? The name of this duct is accessory pancreatic duct. So this duct over here is called as accessory pancreatic duct. So here what did we discuss is that we discussed that there is something called as main pancreatic duct. Main pancreatic duct joins with common bile duct and forms a duct called as hepatopancreatic duct. And next on the top we have got another duct called as accessory pancreatic duct. So you should know that accessory pancreatic duct is opening into minor duodenal papilla, whereas the hepatopancreatic duct is opening into the major duodenal papilla. Another important thing you should know is that here surrounding this hepatopancreatic duct you have got a sphincter. You see there is a muscle that is located here. This is nothing but called as a sphincter. Okay, this is called as sphincter. This sphincter is located around what? This sphincter is located around your hepatopancreatic duct. Okay, this sphincter is called as sphincter of Oddi. Okay, what is the name of this sphincter over here? This sphincter is called as sphincter of Oddi. Okay, next important thing is that this opening, you see, this opening is called as hepatopancreatic ampulla, right? So what I am trying to tell you is that, just look here, this duct which I am drawing here is your common bile duct. Okay, this duct which is already drawn over here is called as main pancreatic duct. So the main pancreatic duct and the common bile duct together they join and form a duct. This is called as what? This is called as hepatopancreatic duct. And hepatopancreatic duct is opening into what? It is opening into a papilla like this. It is opening into a papilla, and this papilla is called as superior duodenal papilla, right? Or you can call it as major duodenal papilla. Now what I was telling you that surrounding this hepatopancreatic duct there is a sphincter. This sphincter is called as what? Sphincter of Oddi. And you see this opening of hepatopancreatic duct here exactly, right? This opening you call it as hepatopancreatic ampulla. Hepatopancreatic ampulla. The opening you call it as hepatopancreatic ampulla. And hepatopancreatic ampulla drains into your superior duodenal papilla, right? So this is the important thing which you need to know. Now there are some other names that are given for these ducts. For example, this main pancreatic duct, whatever is there, so concentrate mainly on these two ducts. Okay, what are these two ducts over here? One you have is the main pancreatic duct. Okay, so one you have is the main pancreatic duct and the other one you have is your accessory pancreatic duct. So concentrate on these two ducts, main pancreatic duct and accessory pancreatic duct. Okay, so this main pancreatic duct is given another name and that is called as duct of Wirsung. What is this? This is called as duct of Wirsung. Duct of Wirsung. Okay, in the same way accessory pancreatic duct is given another name that is called as duct of Santorini. What is this called? Duct of Santorini. Okay, in the same way this opening or hepatopancreatic ampulla, whatever I told you, this is also given another name called as Ampulla of Vater. This is called as Ampulla of Vater. Ampulla of Vater. So there are quite many important things that we have to discuss here, guys. So let us start one by one from the starting. First we discussed is main pancreatic duct. So it is also called as what? The main pancreatic duct is also called as duct of Wirsung. Next important thing we discussed is accessory pancreatic duct, which is called as duct of Santorini. Finish. Next, this main pancreatic duct here, It joins with which duct? It is joining with the common bile duct like. Okay, so it joins with the common bile duct and forms which duct? It forms the hepatopancreatic duct. What duct is this? Hepatopancreatic duct. Hepatopancreatic duct is having a sphincter, and this is called as sphincter of Oddi. Sphincter of Oddi. Okay, and obviously there are two papilla over here. One papilla you call it as the minor duodenal papilla, and the other one you call it as a major duodenal papilla. Minor and major duodenal papilla. Okay. Now I will tell you why the top one is not called as major and why the lower one is not called as minor. So I will tell you in a minute when I discuss regarding the embryology part, you will understand it clearly. Okay. So these are the ducts here, and finally not to forget that we have got over here hepatopancreatic ampulla or ampulla of Vater. Okay. So these are some of the important things which you need to know regarding the ducts of the pancreas. So now later on we shall see how the ducts develop here, we shall see into that. So thank you so much for watching my video. Goodbye.